can start. Awesome. Well, welcome to the Community Outreach Program's poster session for 2021-2022. I'm Mindy Levin. I am the founder and director of SOURCE. My pronouns are she, her, hers. And this is the kickoff to SOURCE's annual celebration of National Volunteer Week. And so we actually have a whole slew of events throughout this week, all the way through Saturday with the service project. So I encourage folks to take a look at our website, source.jhu.edu, and look at all the other great events that we have coming up and invite you to join us. We always love to host the COP poster session. This is a great opportunity for us to basically hear from all the fantastic Hopkins nursing students that have been involved in the community with our community partners throughout this academic year. We have a few of our community partners that have been precepting our students that are able to join us today as well. And we want to thank each and every one of you. And COP, the Community Outreach Program, we call COP, not COP, is certainly a partnership that exists between the School of Nursing's Compass Center, SOURCE, the Community Engagement and Service Learning Center for Hopkins 3 Health Professional Schools, and all of the participating community-based organizations that work with us and collaborate with our students throughout the academic year. And so it's a really fun way to hear from our students and thank everyone. This is just a week-long celebration of appreciation, giving love back to those that have been, equally involved in the community. For folks that don't know about COP and what our students have been doing with us throughout the year, every month we come together as a collective to engage in some critical reflection with our students. We really take a look at what they're learning in the field and how that relates to their future roles as nurses and their professions. So we're really uncovering and unpacking issues that are happening at our community organizations with the that we're working with and collaborating with. We're looking at structural issues as well. And hopefully you'll hear a little bit about our students' reflections on these experiences and what it's meant for their learning along the way as well. So without further ado, we are going to go ahead and begin to share the slides. I will say, I also want to give a big thank you to Lerna, who is our COP program assistant. Lerna was in the COP program last year as a participant, and this year as our student program assistant. Lerna is getting ready to graduate in a few short weeks. Congratulations, Lerna. Lerna is going to be sharing the slides with us, and we're kind of going in alphabetical order of the community organizations. So we are going to start. Let me just make sure I see everybody here. Well, Lerna, you want to start the slides, and we'll see. We might have to go in a little bit of out of order if one of our students isn't here, because I don't see our first presenter. And actually, this is great because it gives us another moment here. There's one thing that I neglected to share with everybody, and this is your active role of what you'll need to do throughout the poster sessions. And that's basically, we're asking each of you to pay attention, potentially take some notes along your way. At the very end of the session, we are going to do a little bit of voting. And there's 3 categories that we're voting on. The first is who gave the best description, then whose poster was the most artistic, and then lastly, the fan favorite. So what is the fan favorite from today's presentation? So you'll have those 3 categories to vote on: best description, most artistic, and our fan favorite. We're going to go ahead and at the very end, we'll share the link that you'll use for your voting. Thanks for folks for turning on their screen so we can see your camera, so we can see who's here and who's in the room with us. I'm going to go ahead. We're going to jump to our very first poster, which is Spring. I'm trying to see if Monique is here. Maybe not. We might need to jump ahead. Lerna, I don't see Monique in the room, so let's go ahead and go to the Esperanza Center slide. And Zachary, we're going to put you on the spot to be our first brave volunteer to give your presentation.
Love it. Always happy to go first. Good afternoon, everybody. My name is Zachary Schenk. I use he, they pronouns. And this year I've had the distinct pleasure of working with the Esperanza Center as part of the community outreach program. So the Esperanza Center was founded in 1963 And it's really a comprehensive resource program primarily for immigrants. So we can see here that the mission of the Esperanza Center is to welcome immigrants by offering hope, compassionate services, and the power to improve their lives. So this is done in a variety of different ways through a variety of different programs that the Esperanza Center offers, from education-related programs to legal services, immigration services, anti-trafficking services, and just kind of general community resources, helping individuals as they navigate moving to a new country and kind of settling down and figuring out how to go about their daily life here in the US. So out of all of this came the COVID-19 hotline team. This is who I was working with directly. This is part of the Esperanza Center's health department, which also has an on-site primary healthcare clinic, and they offer some specialty services as well. So the COVID-19 hotline team really was born out of kind of initial data that was coming out of the first couple months of the pandemic in early 2020, showing that Latinx individuals here in Baltimore were suffering disproportionate high rates of COVID-19 infection. And so this initiative was started to address just that, to make sure that people had access to the information that they needed. We all know that misinformation has been, definitely a big issue, especially in the past couple of years. And so this was a very action-directed approach to helping improve outcomes related to COVID-19. So this initially started through phone calls, a lot of testing, appointment scheduling through phone calls, reaching out to Esperanza Center patient population. But then by the time I came on in November of this past year, we had kind of started branching out and using this program that I've called here WellTel. So WellTel is actually a HIPAA compliant two-way messaging service. So I kind of laugh to myself when I say that there were community engagement activities. I didn't really think about community engagement being entirely virtual, but alas, that's what I was doing. So I was behind the screen engaging with the community, which was definitely a unique experience. But a lot of what I was doing was using this program to reach out to Esperanza Center Spanish-speaking patient population to gather vaccination statuses. I was sending reminder messages on a weekly basis for those individuals who needed more information about where to get their second COVID-19 vaccine or their booster dose. And then the Esperanza Center also gave out some COVID-19 at-home test kits. And so we used WellTel to follow up with those individuals, making sure that they had all the information that they needed, when to use the test, how to use it correctly, and then also following up with them if they needed anything. If they had a positive test result, we would be able to support them in getting the resources that they needed. So moving along, I've put here kind of the two primary learning outcomes here. I definitely learned a lot about digital health tools. This WellTel is one of these digital health tools that are becoming increasingly relevant as we, enter this kind of telehealth digital age. Super relevant for public health, and especially public health nursing, just really making sure that people have better access to health information. There's as we know, as I've mentioned, a lot of individuals just were not able to get accurate, reliable health information over the course of this pandemic. And so this is something that can help address that gap. And then I also learned a lot about some facilitators and barriers to community health work and to, access to healthcare, access to health information, particularly for the Latinx population here in Baltimore. So facilitators, this program, Source itself is a great facilitator supporting, community health work, supporting students as they want to learn about community health and getting involved with individuals and organizations in the community that are already doing that work. So that has been an amazing opportunity. Other examples like funding structures, strategic partnerships that have been in place that have really helped to facilitate this work. So that's been really, really neat to be a part of. And then finally, I'll wrap it up talking about the impact on the community partner. So I've done a lot of data collection and organization, really helping to kind of reduce the workload on existing Esperanza Center staff. And then I'm in the process of developing some how-to diagrams and an accompanying instructional video that will be used to train future community health navigators as they kind of take on this role, and as they kind of also see beyond COVID, what sorts of implications or what sorts of applications could we use WellTel to be able to address other community needs that we are able to identify with our community health navigators at the Esperanza Center. And so kind of just, being able to think through other departments at the Esperanza Center, if they could potentially use WellTel as well, and just providing a little bit of additional insight into how I think that might be a useful tool to kind of loop in other areas of their work, whether that's directly or indirectly affecting their patient population's health. So that is everything on my end. Thank you all so much for being here, and thanks for your attention.
Awesome. Zachary, thanks so much. And obviously super helpful to hear about the ways that you're working to sustain the work that you've done to continue to support the Esperanza Center. I feel like I saw Katie from the Esperanza Center on the call, one of the team members that you've certainly worked with. Katie, you here? Did you want to say anything?
Yes. Hi. Can everybody hear me okay?
We can.
Okay, good. Yes. So we worked together really closely with Zach this semester, and I joined a little bit late. I think he was about halfway through his presentation, but it was so wonderful to have, it was a really great fit for Zach and us to work together, because Zach, obviously he's fluent in Spanish, which was a huge help because he was able to really help drive kind of that messaging that we were sending out via WellTel. But he'd also had some pretty relevant experience doing some kind of communication in the Dominican Republic with patients that was delivered through text messaging. So it was just a really wonderful fit. And I think, we're so grateful for all the work that Zach has done, and he is going to stay on with us through the summer. We were able to get his work extended. And so we're so grateful for that, because like he said, as our COVID work starts to wind down, we have acquired this platform, and we are really starting to think about kind of how, like Zach said, how can we continue to use it to deliver other health messaging? And the really cool thing, and Zach may have touched on this before I jumped on, but the really cool thing, the thing that kind of surprised me about this whole initiative was how much people engaged and responded. Like, it wasn't just this one way we're sending out information of here's how you get a COVID test, or here's where you go to get a vaccine. They were texting back with questions, and then we were kind of engaging in this back and forth conversation and really helping people. And so I think for our population who, they have their work schedules are changing all the time. They don't have transportation. They have tons of kind of social determinants of health that really affect their access. Text messaging is really effective. They don't answer the phone because they're at work, or we can't, it's hard to get them here in the clinic. But so we really want to get creative about kind of thinking about how we can continue to use this form of communication with our population. And so we're really excited to see kind of how Zach thinks about that, and how we all think about that this summer, because that'll be kind of the second phase of Zach's work is pivoting away from COVID and thinking about how we can use this in the future. So yeah.
Awesome. Thank you so much for sharing a little bit more. It's always great to hear people share and celebrate together all the great work. So kudos.
Absolutely.
All right, well, we're gonna move along with our next presentation. So we're gonna have Julia, who's been working with our colleagues over at Free State Justice. So Julia, we'll turn it over to you.
Great. I don't think that Jeremy is here, but I have been working with Jeremy Lemaster. He's the executive director for Free State Justice, and it's been a really great experience for me. I'll start out with just talking briefly about what FSJ does, and I'll move into what I've been working on this past semester. These are just like three main arms of some of the services that FSJ offers. There's a lot more that they do, but often a lot of them fall under training and education piece. So they do education for example, they did an education for LGBTQ healthcare and what that looks like for a mental health team last week. They also do policy and advocacy things. And then my realm this semester is really working on sort of the legal services and social services end of Free State Justice. I gave a few examples there in the slide of some of the services that they offer, like name changes and gender marker changes. That's a lot of the work that they do, but they also do discrimination cases and other things like wills. They do civil cases primarily. And when I talked to FSJ in the beginning of this semester, I guess at the end of last semester, one thing that they were finding was that a lot of the clients were coming to receive some kind of service, but they also had a lot of other needs that they were asking assistance for. So that was related to things like employment or housing or mental health care. And so Mindy, if you don't mind going to the next slide, we'll talk about that project. So for me, I was helping out with a way to track the needs of FSJ clients when they come to receive services, and then B, kind of, or I guess twofold, was to track certain outcomes that relate to safety and well-being that help with their grant reporting, and that also help them track as an organization their progress. So it's a matrix of like 8 or 9 domains, and that includes the things that I already mentioned, like healthcare, employment, mental health. And it essentially is just a short questionnaire that hopefully can be done within 20 minutes online, or it can be done over the phone, that can do those two things. So overall, looking at for each client, some challenges when it comes to safety and well-being, and then also tracking for data in regards to those measures and seeing if it's any different after those clients are done using FSJ services. So for example, what does their housing look like before or right when they call FSJ, and then what does their housing look like after their case is closed or after they've made contact with FSJ. The FSJ was finding that a lot of their calls, it's not an exact percentage, but what Jeremy had told me was a little bit, about half, they had to turn away because a lot of the cases can't be legally processed or prosecuted. But a goal of SSJ is to increase the lived equality for low-income Marylanders in particular that are LGBTQ. So this project kind of comes out of that, is like, what needs do clients have? And if we can't help them with legal services, are there other areas that FSJ can help them or refer them to services? That's a dream and a hope that they have. So that's where I spent my time mostly. It was building this tool. There's a tool called the self-sufficiency matrix, which I used to build mine, that was used with a program in Arizona. And also I got to meet weekly with Jeremy, which was so great. And I learned a lot through him. I think that that's how I ended up learning more about LGBTQ resources in general. And I also was able to talk to a handful of staff and meet with them as I was building the tool. And so the impact was, I'm actually still finishing up the tool. I'll be done next month. I'm going to present it to the FSJ team in a few weeks. And hopefully my impact is that I created something that's pretty simple and easy to use, and also has some open-ended questions. I think when you're tracking needs, it's important to try to see A, what people need, but B, what they think is important that they need. So just because you think that a client might need something because Maybe they have issues with their housing, but maybe they don't care about addressing things with their housing. Maybe they care more about their mental health right now. So those are kind of all of the things that I tried to incorporate in the tool. And it's been a really great experience. I think that I'm going to continue volunteering with FSJ throughout the rest of the program. And yeah, I'm really thankful for it. So
awesome. Julia, you'll have to let us know how it goes after you give your presentation to the team. So
I will.
Sounds like great work that you've been doing, and I'll on Jeremy's behalf, thank you, because I'm sure they'll be thrilled for the work that you've done. Thanks for keeping up the great work. Awesome. All right, we're going to go back. We're going to have Lerna rewind a little bit so Monique can give her presentation. She's been working with Dayspring programs, and Monique, I'll turn it over to you.
Awesome. Hello, everyone. So sorry, I was a little late. But yeah, I've been working at Dayspring programs, and their mission, or yeah, I guess like their summary of them is that they are a transitional housing facility where parents who have history of substance abuse and or homelessness, that's where they live and like go through programs to like rehabilitate themselves. And then once they complete the program, then that's when they like re-enter into like the community with like subsidized housing, follow-up services that are supportive and whatnot. So I don't work directly with the moms because I haven't met any fathers, I've only met moms, but I haven't worked directly with them, but I have worked with their children. And so at the beginning, these are the health topics that they wanted to include. So when I first went to Dayspring, wait, you can go back for a second. Yeah, when I first went to Dayspring, it started off with me meeting the moms at first and with Rhonda, the housing supervisor, to just ask like, hey, instead of me just thinking about what I want to teach the kids, what do you want me to like teach your children, and like what do you want me to basically do here? So these are the topics that we've been doing so far. We've done some of them several times, like we've done importance of moving our body because the kids can be energetic sometimes, and I like to make them tired. But then also just reiterating the importance of like movement and what that does for our mental health. But a lot of the focus has been on self and emotional regulation. And then you can go to the next slide, please. And then, so we've done a lot of activities. I have so many pictures and videos. It was hard to just use just a few of them. But sometimes I'll have an older kid because there's such a wide age range from like, I have 3-year-olds sometimes. Lotus I've had was 12. So it can be a little hard to like, me and my 25-year-old brain break those topics down. So then I'll like, hey, let a kid like help out. So that's what he's doing in this picture in the top left one. And then they like really engaged. I mean, it was kind of staged for the picture, but so I was like, everyone look at the board, but it was good. It was good. And that was on anti-bullying. But then when we did Children's Mental Health Matters, we were drawing a lot because instead of journaling, like how I guess we would do some coping strategies, I say, okay, since maybe not all of us can write, how about we draw our feelings? So on the left side, you have the kids when they're happy. So I said, draw a picture of like what makes you happy. So you have ice cream, flowers, and then like sisters playing with each other. But then on the right side, all 3 of those pictures are rain because they say rain makes them sad. And I was like, wow, I love rain, but okay. So for the community impact and outcomes, since I did the needs-based assessment and I didn't just assume what the children wanted or what the parents wanted me to teach them, I would expect that the impact would be improved relationships within the home, especially because I teach a lot of siblings. And they do argue and hit each other a lot, but it's decreased. I have noticed that it has decreased over the time that I've had them since October. And then another impact would be increased emotional intelligence because we go over a lot of the topics over and over again. It wasn't just like a one time and then leave it. So hopefully that would have led to increased empathy towards others and how they can understand their own emotions and how their emotions can impact their friends at school or at home. And then just to keep introducing different health topics to kids that they wouldn't have otherwise noticed. Because when we talk about parental addiction, the homelessness aspect, and parental addiction, homelessness, and there's another one on that last slide that I'm like blanking on right now. But I think they may have like seen that, and obviously it's a lived experience that they had in the past. But it's like, well, like what actually happened, and like knowing it's not their fault. And we went through like a whole Sesame Street curriculum. It was really fun, and I think they enjoyed it a lot because they were obsessed with the Muppet Carly. But yeah, so I think the kids have been enjoying it, and I'm gonna see them today at 4 p.m. and then we'll have like a party in like a couple of weeks when it ends. But yeah, so the next picture or the next slide. This is when we did our yoga, and the top picture, it was a grateful giraffe. No, was that giraffe? No, I think that's a tree. But yeah, again, just so many pictures. So I didn't want to add like my name all big and obnoxious, but they're a great set of kids.
Awesome, and thank you so much for sharing. I know that the kids and the moms certainly appreciate having you there on a weekly basis going over these health topics. So thanks so much for sharing a little bit more about what it meant for you, and certainly the added benefit that you were able to provide for Dayspring and the young people there. So great job. Thanks. All right, so we're going to fast forward a few slides so we can hear from Grace, who has been volunteering with Gilchrist Hospice. Grace, I turn it over to you.
Hi, so like Minnie said, I've been volunteering at Gilchrist Hospice Care, which is a nonprofit provider for serious illness and end-of-life care. And so their goal is to provide counseling, support, and care to anyone who has a serious illness, just to make their last few months of life as enjoyable as possible. And so the things that as a volunteer we can be involved in are visiting hospice care facilities, talking to patients on the phone, and then you can do other things like deliver groceries to families that may not be specifically in the hospice facility, but has hospice at home. And there's also small projects you could work on. If you know how to sew, you could also work on getting clothing from a loved one that has passed away, and then you would sew the clothing into clothing for a teddy bear so that the family could keep it as a memory of their loved ones. So specifically for me, I visited hospice care facilities, and I conversed with the patients that were living at these facilities, and I conversed with some patients on the phone too. And what I learned from this experience is that I learned a lot about the different lives and perspectives of these patients that I wouldn't have known if I didn't talk to them. And I also learned that physical presence is just as important as conversing with the patient. So some of these patients might not necessarily want to talk, but that doesn't mean I just ignore them during my visit. I would sit down, let them know I'm here, and then just having the presence was something that some of the patients found comforting, even if they didn't want to talk. And then I think the biggest thing I learned with volunteering at Gilchrist Hospice Care was having a better understanding of end-of-life care. Even though I know we read about it in our textbooks and learn in lectures, I think going to hospice and seeing what that entailed was a different experience than what I expected just from what I learned in class. And then my impact on the community partner, I would say that providing companionship and comforts for the patients was the biggest thing, and just engaging with the older adult population in the Baltimore community.
Awesome. Thank you, Grace. Grace, I also want to commend you because I know becoming a Gilchrist Hospice Care volunteer actually takes a considerable amount of training and onboarding to be prepared to be working with the patients and their families. So great job on working hard in that way. And you also did some pivoting throughout the year as the organization was making their guidance and change with the pandemic. So I'm glad that you ended up having to have both the in-person experience with families and patients, as well as the work that you did by phone. So thanks for all that great work.
Thank you.
All right, so our next poster is actually a duo. We have had Christopher and Emily have been working throughout the year with Henderson Hopkins School. So I'm going to turn it over to Christopher and Emily, and I do see that Dr. Francis is here as well. So Christopher and Emily.
All right. Hi, everybody. I'm Chris. I've been working with Emily, a DNP student, Veronica Lee. She's not here today, and our excellent preceptor, Dr. Francis. So we've been working at Henderson Hopkins, providing SNAP Ed education for the students there. We do it through the Read for Health program. It's basically, we read them a book, do some activities with them to promote good eating habits as well as exercise. So The school, we provide the education for kindergartners through second grade with an average of around 20 students per classroom. Most of the students are from the East Baltimore surrounding area, and the school is actually funded by Hopkins. So many of the students have parents who are faculty members. Some of the community engagement activities, like I said, includes reading stories, promoting exercise. We did provide snack and drink recipes to the students to hopefully have them take it home and do the same thing at home and retain some of the information we taught them. And the image on the right is an example of one of the books we read, Happy, Healthy AJ. This one talks specifically about physical fitness. Next slide.
So our learning outcomes, they were to promote nutrition education and importance of good diet and exercise at a young age. We also wanted to provide the students in possibly disadvantaged households fun, easy, and healthy recipes for various snacks and drinks to try at home. So we would have a printout sheet of a recipe, and each student would bring that home so that they could show their parents and hopefully try the recipe at home with their families. As nursing students, we gave them an opportunity to work with, we had the opportunity to work with children and understand the importance of good habits early in life. So our goal was really to target kids at like a younger age so that we could hopefully help influence what types of foods and hopefully like healthy eating habits and exercise that they would be interested in, so that as they grew older, it would go, the lessons they learned would go with them. And so the impact on the community partner was educating beginning at a younger age, and in order to encourage healthier eating habits, and really just to also encourage activity and making sure they stay active and stay hydrated, because we also had lessons about drinking water. We also want to expand children's palates and introduce them to new fruits and vegetables. So we had little flashcards, as you can see in the picture, that had different fruits and vegetables. And there were some that some kids had never seen before. So we definitely wanted to try to help them learn about new fruits and vegetables that they could potentially try. And we encouraged the families to try recipes by providing them recipes for the kids to bring home, so that we could promote healthy eating at home as a way, as part of like the SNAP food stamp program, so that when they do go buy their groceries, that they are leaning toward buying healthier options. And yeah, this is what we've been doing at our site for the most part. And it's been really enjoyable. I know we both really enjoyed interacting with the kids and hearing all the creative ideas that they've had when we ask them interactive questions.
Great. Thank you both so much. Emily or Chris, was there a particular vegetable or any other food that you said that they weren't familiar with that you remember?
Yeah, for me, it was a leek. I don't think I ever actually had a leek, so I didn't even know what that was either, but yeah.
Nice. And I see Dr. Francis in the chat, wonderful work. So sharing her sentiments as well. Dr. Francis, did you want to say anything, or just in the chat, not to put you on the spot, but I
just want to say with each cohort, there's something new and something fresh. And I just thank Christopher and Emily, and they were, welcomed by the Henderson Hopkins community. But I'm most impressed with how they were able to arrange with the teachers, work with the teachers to get into the classrooms, and really just be super organized with the recipes. And I also want to thank Veronica Lee, who's a community health nurse operating out of our Compass Center, who was also of great assistance to our students. So great work, guys.
Awesome. Thanks so much for chiming in and sharing your good comments there as well. All right, so we're going to keep going. And next we're going to hear from Marley, who has been at the House of Ruth, Maryland this year. Marley.
Hi, everyone. So my name is Marley. I volunteered with the House of Ruth, Maryland, and their main purpose is to help victims of intimate partner violence. So we can go to the next slide. So their main mission is, and their vision is that one day every woman in Maryland will be safe in her own home. And I just have this quick little statistic, 6,923 adult victims and 535 children were supported by the House of Ruth, Maryland in the 2021 fiscal year. So like they have a broad scope supporting community members who are victims of intimate partner violence. And then we'll go to the next slide. So for me, in terms of activities, I participated in health talks with residents of the House of Ruth, Maryland, in conjunction with 2 of the community nurses that work there, and med students from Hopkins. And that was just general, they would find out different information about health topics that the residents wanted to know more about, and it would just be a really interactive opportunity for them to ask a lot of questions. And then I designed monthly newsletters and updated like information for the health bulletin board suites, and just made sure that the information was accessible for them to access, and there were different resources that would meet their like needs and comfort levels. And then I'm currently working on the mental health and well-being section of the health passport. So there is a health passport that was created that is broadly for victims of intimate partner violence to take with them wherever they go. So it has information about their like history and current conditions, and they can put their blood pressure and things like that. So now I'm creating an insert that's specific to mental health and well-being that can just be put into the passport that they already have, and really just like give them an opportunity to have some resources and tips and tricks to like cope with certain things, or reach out to other people if they feel like that's what the direction they want to go in. I think some of my major takeaways was just how different every situation is and how it affects people differently. You know, literally every situation is so incredibly different, and people need support in different forms. So not everyone needs a hug or, you know, different things like that. Like everyone needs to, who's working with these individuals need to be open to support them in the ways that they need and their family needs. So just being really flexible has been a really big takeaway for me. And now broadly, I would say that the House of Ruth, Maryland now has some updated resources and points of contact to share with the residents. So as I mentioned earlier, I designed like newsletters and updated information. So some of the things that residents mentioned, particularly having interest in learning more about, was nutrition, cardiovascular health, and pre and postnatal resources. So I worked on that. And then by the time I am done with the House of Ruth, I will be leaving them with their mental well-being and health passport insert. And I'm working with Dr. Wilson on that now. So that should be done soon.
Awesome. Great work, Marley. I'm certainly glad to see you adding to the great work of the health passports that the Compass team has had at their various sites. And certainly the mental well-being section is certainly going to be of great value for the House of Ruth, Maryland. So kudos to you on your great efforts as well. And thanks for sharing. All right, we're going to go next to hear from the team that's been working with Jubilee Arts. So Caitlin and Julie will be able to share about their experience.
Hi, everyone. I'm Caitlin, and Julie and I had the opportunity to work with Jubilee Arts this session. And it's really been a great opportunity to work with the community of West Baltimore. It's kind of located on the other side of the city. So that's been a really cool opportunity to get to know the people of the area a little bit more, and just the area in general. So Jubilee Arts is the community arts program located in West Baltimore, and it's a part of a larger community-based organization, Intersection of Change. And its mission is to address poverty-related challenges in the area through a number of different smaller organizations like Jubilee. And Jubilee's goal is to provide ways for participants to tap into their creative and artistic sides in an accessible and affordable manner. And it does so by offering supplies to students and scholarships for individuals who may not be able to pay the fee for class. And they really just go above and beyond to ensure that everyone in the community who wants to participate in the program can. And for our duties at Jubilee, a lot of our work has been administrative. And in the winter, we were online completely, but in the spring, we've had the opportunity to go in and see the studio and actually meet the people we've been communicating with online. So it's been really nice to put faces to the names and just interact with students in person. And another thing about Jubilee that I forgot to mention beforehand is that it truly does serve the entire community, and that it offers classes for kids as young as 3 years old to up until older adults. So I think that's really, really cool about the organization. So we complete phone outreach before classes and after classes, just to kind of catch up with people and just see how they're feeling about class, and if they have any questions that they would like us to relay on to maybe the program director or teachers. We're responsible for hosting Zoom sessions in the winter and taking attendance during those classes. And we also send out follow-up emails just to remind people in text about classes and remind them about if they have any questions to reach out to us or the program administrators. And we are also tasked with the responsibility of calling people before class session starts, just to kind of boost enrollment for classes and see if anyone has any concerns or questions about in this session in particular, the movement from online classes to in-person classes. And as for our impact on Jubilee in the community, we were able to lessen the administrative burden on the Jubilee staff, and whether it was like making those phone calls, sending out the emails, or just taking attendance during Zoom classes, we were able to help the teachers and make sure classes ran as smoothly as possible. And it's really important to ensure that all students have the time to go through class uninterrupted and capitalize on their time, because it's just an hour a week in that class. And you want to make sure that they're taking the most out of the class and learning and just really having a good time. And with interruptions, it can definitely hinder that. And as we've learned in our classes, art can be a huge stress reliever and also a diversion for maybe anything that's going on at home that you don't know about, and just helps people express emotions in a really healthy manner. And given the climate of the pandemic and how difficult school can be for school-age children, we want to make sure that art class offers the ideal environment for people to feel relaxed and make great art. And we've really been able to learn a lot in our time at Jubilee. We've garnered really important communication skills that we can take into our nursing practice and throughout our nursing education. And we've also just been able to understand people fully and lend a listening ear when needed, when you're making those phone calls and you don't really expect people to keep talking, but you do, and you're able to help kind of foster communication between the administrators and then the participants. And we've also recognized the profound effect of art on the community and its ability to empower individuals and students to really kind of promote change in the community. And just, it's been really, really cool experience, and we're really grateful for our time at Jubilee.
Awesome. Thanks, Caitlin. Julie, is there anything that you wanted to add? And I also see that Grace Wren from Intersection of Change Jubilee Arts is also here. So I'll give you a chance if you wanted to say anything as well.
Hi, yes. So I'm standing in for Nora and Miss Black, who are like the main Jubilee Arts team, but they did ask me to pass on a message just to say thank you to Caitlin and Julie. Like Caitlin mentioned, this past spring was the first back to in-person session since winter 2020, I think. So Caitlin and Julie both were just such a huge help with doing outreach, which is like a huge part of why we have such great engagement and attendance at Jubilee. They were super helpful with that, made the transition very smooth. And like Caitlin also mentioned, taking care of those kind of behind the scenes administrative tasks, like aren't really things people think about, but they are so imperative to creating like a smooth operation. So yeah, Nora and Ms. Black both just wanted me to tell them thank you and let everybody know that they did a great job.
Awesome. Thanks, Grace, for sharing that. Okay, well, we're going to go on to our next presentation. We're going to be hearing from Mira and Julia, who's been at the Light of Truth Center this academic year. I'll turn it over to you.
Hi, thank you. I'm Julia, and like Minnie just said, me and Mira have been working with the Light of Truth Center this semester. And the Light of Truth Center is a nonprofit organization, actually like really close to the nursing school in Baltimore, that's organized, that is dedicated to providing a safe and supportive housing environment for women who are in recovery from addiction, to help set them up for the future as well. And we've really enjoyed this experience and getting to work with Light of Truth. I think they definitely, one of the first things we noticed when we went for the first time was how it feels like it smelled like pancakes, I think, and it's really felt like a home. And so they definitely have created a very nice environment, and I'm really grateful that we got to work with them this semester.
And so what we did is basically a continuation of the last like source cohorts project where they drafted a presentation about medication and self-advocacy in the healthcare setting. And then Julia and I took it and gave it some edits, and then we formed a presentation that we have been presenting to the women who are residents of Light of Truth, in addition to the staff and the board. And this presentation basically includes information about like how to build the foundations of self-advocacy in healthcare, and how to take steps towards it. So we talked about how to gain a better understanding of your conditions and possible treatment plans that are available to you, how to approach addressing questions with your providers. We also opened up discussions with them about like hypothetical situations, like what would you do in this situation? What would you say that this person should do if she's feeling this way? But they're also very real situations that they have experienced themselves as well. And then we also talked a little bit about how to manage pill burden, and also just how to recognize it, if you're maybe in a red light situation where your medication is really not working for you. And we really tried to emphasize trusting in your body, because nobody knows your body the way that you do. And I think a lot of times these women who have gone through addiction are often kind of told that their experiences aren't validated, or that what they're feeling is not anything to worry about. And so we kind of use this presentation as a way to hopefully empower them and recognize that what they're feeling is valid.
I think Mira and I both learned a lot from this experience, but some of our main takeaways are, one thing, we watched a training on love-based leadership before we really started working with Light of Truth. And I think that really made an impact on us. And kind of one of the big ideas that stood out from the training was just the importance of having like love be a motivating factor behind everything that you do. And I think that was something that we really witnessed in all of our interactions with Light of Truth. And it was really a great experience to get to see that modeled and to try to integrate that into our lives a little bit more. And another thing that stood out to us was the importance of flexibility. I think we were always met with a lot of flexibility when things came up for us, and we tried to be flexible as well. And I think that definitely created a much better and more like welcoming relationship. And another takeaway that we had was the importance of supporting people throughout the entire process of recovery from addiction, because I think a lot of times there's a lot of support for like the initial push to like quit using a substance, but not a lot of support for like maintaining that recovery process. So the importance of like keeping up with that as well.
And then in terms of our impact, we're really happy that this is something that we'll be able to stay with Light of Truth even once our project with Source is done, because there's going to be a digitalized version of it. We'll be sharing a recording, and it's going to be used in future trainings with Light of Truth, and also be able to be viewed on the Light of Truth website. So we're really happy that we're able to have this lasting impact. And overall, of course, we hope that our work with Light of Truth is able to help reduce over-medication, given that they hopefully now have the toolbox to be able to advocate for themselves in the case if they feel that their treatment plan isn't working for them. And then overall, just feeling empowered to be able to talk to your provider openly about things that are bothering them, because what they're going through is not easy, and they need someone who is going to listen to them and hear out what they're feeling. But thank you.
Awesome. Thank you both, Julia and Mira. And I do see that Reverend Val Leonard is on the call. Val, is there anything you wanted to add about your experience working with Mira and Julia?
Absolutely, absolutely. I just can't say enough about the experience that we have. Put it on. Just a moment, I'm going to adjust my camera.
No worries.
There we are. I just can't say enough about them. From the very start, they took the time to sit, to listen, to embrace the Light of Truth, to come in and talk with the women, to get a feel for the environment, to ask questions about recovery and addiction and our process, our love-based leadership process. Once they took the time to just sit with us, and sometimes when you have a schedule, people are a little hurried, and they weren't hurried at all. They came in and really, really took the time. They took the information that we had and expounded upon it in the most marvelous way. They didn't show you the whole presentation that they had, but I want you to know that it was so wonderful. So much so that our board of directors was just wowed by their presentation. Very rarely do we have the participants come back and say, can we do that again? Can we continue to use that? And we have other board members I have board members from Chicago, from Virginia, from other states that saw the presentation and wanted it for their organizations as well. So I just can't say enough about the presentation itself, the manner in which it was presented, and the information that was provided was just magnificent. Our women continue to struggle with the medical community to actually have their voices heard. And when their medication, when they're over medicated, they know it. They have difficulty managing their medications. They have difficulty being in groups. This is the tool that we have been looking for, that we can use on an ongoing basis to support the women to be able to find their voices, to speak up for themselves, and to be able to advocate with the medical profession for the medications that they're receiving. So thank you, thank you, thank you. You did a wonderful job. This is a tool that we will be using in orientation. This is a tool that will be on the website. This is a tool that we will be using for staff trainings. I mean, this is just more than we had hoped for. And all I can say is thank you.
So beautiful. Thank you so much for sharing that. How meaningful. That just speaks volumes for the work that y'all have done. And obviously one of our goals in our programming is that this work is mutually beneficial. We're having all of our students talk about the impact it's had on them and the impact on the organization. So, this is just a big old love fest in your love-based leadership. So glad to hear it. Well done.
Applause.
Thanks so much. All right, so we're gonna go. We've got 2 more posters and fantastic nursing students to hear from. Jessica's going to go next to talk about the work they've been doing at Spark.
Hi, everyone. I'm Jessica, and I've been at Spark Women's Center. So Spark is sort of like a health clinic, but they do so much. So just an all-around wonderful center in Southwest Baltimore that serves women and non-men who are involved in sex work, who use substances, and who also face housing instability. Spark conducts various outreach shifts, and they also offer a variety of in-house services that focus on harm reduction. So for the community engagement activities, this list is definitely not exhaustive. They do so much for the community, and it was just such a wonderful experience working with them. So they do medical outreach. They do a lot of STI testing. They can look at different wounds and abscesses that the participants might have and things like that. They also have sort of a supply-based outreach, which is what I worked with closely. And we delivered a lot of clean syringes and safe drug use kits, safe sex supply kits, different things like that. They also have medical treatment and diagnostics. They have a few nurse practitioners that work there, and they're really wonderful. They also have case management, and their case manager does so much, but they help with getting the women forms of identification, housing, insurance, just different things like that. They have a few mental health counselors, and the women it changes with the COVID policies, but they can sometimes come in and do laundry and showers, which is really wonderful as well. So for my learning outcomes, I focused on identifying needs of the participant population, understanding basic principles of harm reduction, and I completed a few trainings on that. And then identifying valuable resources for participants. For my impact on Spark, I increased the number of outreach supplies, so making different kits that we would distribute, and also assisting on outreach shifts. I just wanted to thank Katie and Haley and everyone at Spark. I've had such a wonderful opportunity, and I feel like I've learned a little bit from each one of them, and I'm really lucky to continue working there. Thank you.
Awesome. Thanks, Jessica. I do see Haley's on. If Haley, if you wanted to say a few words about your partnership with Jessica?
Yeah, absolutely. First of all, shout out to everyone so far. Presentations have been great. And yeah, Jessica, one thing that really, caught my attention about her is, she first showed up, we asked her, what caught your eye about Spark? It's a very unique program. And sometimes you don't always see that in different parts of the world or the US or what have you. And what really stuck out is her response was talking really about patient focused, people focused. That's a really rare thing. And that whole mentality of meeting people where they're at, not leaving them there, really holding space and adapting and being dynamic, really great traits. And it was really seen as she did various things on outreach, hopped in different roles, helped out the center with different things. We're really lucky. And I tell you, every time we had a team huddle, I feel like every time Jessica's name came up, everyone's like, okay, yeah, that was a great meeting. But about Jessica, it was really fantastic to have her on board. I'm really happy to have her still around. So great work.
Awesome. Well, thank you to both of you. And I appreciated hearing about the team huddles throughout the year. Haley always was given the shout outs to share back with Jessica to congratulate you on your great work to support Spark and the folks they serve. So well done. All right, we have one last poster, although I don't know if I saw Alex in the room. Alex, you here and I'm missing you. I do see that Dr. Ling, who is your preceptor, is here.
Hello.
Hi. All right, but I don't see Alex. All right, Catherine, I don't know if you wanted to say anything. We have Alex's slides, but that's about it. I know they've
Alex has been, Alex has been an incredible force working with us both at Walden with the Compass Center as well. This year has been a restart from many of the challenges that we've had with COVID and looking at how do we safely move back into the community and interact and give them the services that we need. And Alex has really been a pivotal point in working with us, especially with our blood pressure screenings at the Northeast Market and making sure that we have the teaching and materials available there, making sure that we're giving the community members the information that they need, as well as making sure our protocols are good so that he can feel comfortable when he sees something, he can say something and he's got backup as we begin to work with that. So he's been really wonderful throughout all of that. We've been very lucky to have him.
Awesome. Thanks so much for sharing, Dr. Ling. All right, so Lorna, the next slide we have up here is now the opportunity for folks to actually vote. So you've heard and seen some great presentations from all of our COP Hopkins nursing students. We have put together a quick little vote, which I just dropped in the chat on a little survey poll that you can take. And we'll invite you now to just go to that URL and you have the opportunity to vote on our 3 categories. We have who gave the best description overall of their COP work, who had the most artistic poster, and then of course, just your overall favorite. Feel free to go ahead and vote using the link that we just gave. Lorna, I don't know if we're able to see the results live or not, so I'll ask you that question. We were having issues with the poll everywhere, so let Lorna chime in.
No, we can't see it live, unfortunately.
Okay, so we'll have to follow up. We know everybody that's here because that's the miracle of Zoom, that who's in the room. So please take a moment to put in your votes, but I will, while you're doing that, do a quick kind of wrap up for everybody. As we know, for our nursing students, most of you are going to be working through May 13th, which wraps up the academic year. There's a few of you that have received some extensions to work a little bit more into the summer. And a few of the next steps that are going to happen for our nursing students is that you'll have 3 kind of things that you have to do to wrap up. We will give you a final overall COP program evaluation. We'll also have you kind of wrap up with the School of Nursing with HR. So we know that we're closing out your paid opportunity. And of course, make sure that you do an official wrap up with your partnering community-based organizations. So for some of you, that wrap up will come sooner than others that are going to continue into the summer. And for all of our community partners, you will also have the opportunity to do a final evaluation of the program, looking ahead for the future and see what things we could do to continue to improve the work that we've done. I felt it was echoed very much in a lot of the things that our students said and a few of our community preceptors that were able to be here. This is just meant to be something that is mutually beneficial to everyone involved. We want our nursing students to have these fantastic experiences, really have the opportunity to work directly with people in our communities and to learn a little bit more about working with these organizations. And for our community partners, you have put in a lot of time and effort to collaborate with our students to help educate them about the work that you're doing and make them feel like parts of your team. And, you know, really everybody feels that they, in the end, have come away with learning and improving each and every one of us from the experiences that we've had. So I do want to thank you. I always love this experience and this opportunity to connect with so many wonderful nursing students and our tremendous community partners. So on behalf of the Compass Center at the School of Nursing and Source for the Health Professional Schools, we just want to say thank you to everybody and job well done. And don't forget to join us at other National Volunteer Week events throughout the rest of the week. Have a fabulous day, everyone, and thank you for your great efforts. I know there's a few more weeks to go, but this is just a great way to kick off National Volunteer Week and say thank you, well done, and we appreciate each and every one of you. Thanks, everyone.